This content was made possible through support from Delta Dental. Good oral health plays a vital role in the overall well-being of a person living with dementia. With a few simple strategies, you can make it a positive and comfortable part of everyday care for both of you. In this video, you will learn to recognize the importance of oral health as part of dementia care, identify common challenges and changes that affect oral hygiene, apply practical strategies for supporting daily dental routines, and seek help from dental professionals and Alzheimer's Association resources. Oral and dental health are important for everyone. For people living with Alzheimer's or other dementias, good oral hygiene supports comfort, dignity, and overall well-being. It also plays an important role in physical health, affecting nutrition, reducing pain and discomfort, and lowering the risk of infections and other chronic health issues. Let's hear from two dentists about why it's important to pay attention to dental care.
Oral health is related to so many other health issues. For example, diabetes, heart disease, and even dementia. Gum disease and inflammation in our mouth can actually worsen dementia. Secondly, we all need our teeth to eat, to chew, and to get proper nutrition. And perhaps most importantly, our mouth is how we connect with people, how we smile, how we communicate.
Certain changes in memory, behavior, and physical abilities seriously affect person's ability to perform oral hygiene. Memory loss can lead to people forget about brushing or flossing. Sometimes a person can forget what the toothbrush is. Sometimes people brush repeatedly, forgetting that they have done it in the past, or they just refuse brushing, thinking that it was done already.
Let's listen to David and Dave, caregivers who saw oral care changes in the person they care for.
For years and years, my wife liked to go to the dentist. It was just not a problem. And she loved the hygienist. But then there came a point where she couldn't really follow the instructions of the hygienist. And the dentist suggested, we had been seeing for years, that there are some people who have a little more specialty, a little more expertise in dealing with Alzheimer's patients. So we went to a different hygienist, and that's worked out really well.
Arthur is a friend of mine, and I'm part of a care team to take care of him. We checked with the care home regularly to see if he was brushing, and we learned that he wasn't. And that's when we then said, well, we've got to do a better job. We've got to take him more often because he's not brushing his teeth and he's not allowing any caregiver in the care home to brush his teeth.
It is common for a person living with dementia or Alzheimer's to become confused or resistant to oral hygiene. A good way to approach this is with patience, flexibility, and understanding. In the early stages of Alzheimer's, a gentle reminder to brush may be all that's needed. As abilities change over time, it can help to simplify the task and set things up in advance. For example, you might prepare the toothbrush with toothpaste and place a cup of water nearby. Handing someone a ready-to-use toothbrush can sometimes be the cue they need to get started. Simplify. Give one short instruction at a time, such as hold your toothbrush or spit in the sink. Show. Use watch me or tell, show, do techniques to demonstrate what to do. Brushing your own teeth alongside the person can also encourage participation. Let's hear from David on how he's navigated at-home dental care.
Generally, what helps with brushing of the teeth is I do it at the same time she does it. And generally, I try and make it light, fun, distract her, and try and get as much done as we can.
If a person with Alzheimer's or dementia is having a hard time taking care of their oral care, there are several strategies you can use to support daily dental routines. Adapt the tools. Try a soft toothbrush, a children's toothbrush, an angled handle, interdental brushes, or oral wipes. Set up for success. Create a calm environment, gather supplies ahead of time, and use towels or gloves if needed. Be flexible. If brushing in the bathroom after breakfast or before bed causes stress, try a different time, place, or approach. And if the person becomes upset, pause and try again later when things feel calmer. Check dentures. Rinse dentures after meals, brush them daily, and soak them overnight. Observe. Watch for signs of pain or discomfort, such as refusing food, frowning, or wincing. Collaborate. Let the dentist know the person has dementia and continue dental visits as long as possible. Here's Dr. Tagve on the importance of regular dental visits.
I recommend that a person with dementia or Alzheimer's come into the dentist at least every 3 to 6 months. The exact frequency really depends on each person, and your dentist or hygienist can customize that for you and make a recommendation. But the point is to come in often so that your dentist or hygienist can focus on prevention and catching problems early on.
As a caregiver, knowing when to seek professional guidance from your dentist can be unclear. Sometimes the person you are caring for cannot tell you when they are experiencing problems in their mouth. Here are some signs you should look for: refusal to eat, swollen gums, facial swelling, white sores or patches in the mouth, and broken teeth. While the benefits of good oral hygiene are numerous, David has one more valuable piece of advice for caregivers.
With brushing teeth, like everything else in caregiving, I try and give myself a break. It's not going to be perfect. As long as she's safe, that's all I really have to be perfect about. And she's doing as well as she can, so am I, and I'm trying to give myself and her a break during this process.
You are not alone on your caregiver journey. We are here to help and support you. For more information, call the Alzheimer's Association 24-hour helpline at 1-800-272-3900 or visit alzconnected.org to connect with other caregivers.